Hi everyone, and thank you for coming to our virtual poster. My name is Sarah Knowles, and I'm talking today about our study, which is a collaboration between TUV and Library Services and the University of York to evaluate their evidence access service, which is a service where staff can submit questions to the library, and the librarians will then perform a literature review and provide them with a review summary of the evidence in that area. And we wanted to explore who was using that service and why and the kind of impacts coming out of it, and also think about opportunities to improve the service, particularly building more collaboration in there with ourselves at the University of York. And we collected a variety of qualitative data to inform that. So what we found was that this is a really high demand service. It's the most popular reason for accessing the library. They get about 300 questions submitted a year, and not just, for example, about training or CPD, but staff were reporting that they access this service to inform treatment decisions or to guide strategy. In terms of who uses the service, the mental health nurses are the largest staff group in the trust, but were particularly underrepresented as users of this service, with barriers suggested both as the kind of lack of time and less support to engage in research beyond their initial training. The rapidness of the response was really praised, the timeliness, and also that it was personalised in the sense that as interests and questions developed over time, the librarians would continue to work with people to help that development. The presentation of the reviews, however, how much synthesis or appraisal was included, was inconsistent and essentially determined by how much time the librarian had rather than by, for example, the question itself. We thought about missed opportunities, particularly thinking that this would be a great opportunity to assess and build capacity amongst staff themselves in terms of how much their confidence in evidence appraisal or in research methods. And there was a lot of interest, particularly in the idea of generating new research questions through this. So if a question was submitted which linked with university priorities or which identified a really important evidence gap, this could then be worked up with the university, and this would be a question that had actually emerged from the heart of the NHS to meet needs of health practitioners. In terms of what it means and what we do next, we use the iParis. So in terms of the innovation itself, we've got templates that have been usability tested with staff to try to make the presentation of reviews more consistent. Particularly, if this evidence is being used to guide treatment, then we need to make sure we're being really responsible and rigorous about presenting the evidence and the limitations of the evidence. In terms of the users, we want to increase awareness of the service amongst mental health nurses, particularly try to understand some of the barriers. I think the COM-B model, capacity, opportunity and motivation, could be really useful there. We want to understand what use of evidence in practice really looks like. How is the evidence informing what's done, and how can we track this and measure the impacts? And lastly, as mentioned, we want to try and build capacity amongst the staff themselves for evidence appraisal and confidence to engage both as users and producers of research. In terms of the context, there is a supportive context in terms of high-level policy and strategy commitments to research and evidence, but this wasn't always being communicated on the front lines, and so particularly we want to work with research champions, who are individuals in teams and in units, to make explicit the trust support for accessing evidence and using evidence, and also perhaps put together some case studies that demonstrate how questions that emerge from practice can then be informed by the evidence and lead to improvements in care. In terms of facilitation, I think the study really shows how important librarians are, that they're valued not just for kind of the skills and time they offer, but they're really trusted as a source. They build relationships with staff, they're approachable and accessible, and this is what makes the difference in terms of helping staff to engage with the service. And we want to explore how to expand their role, so they're not just kind of providing access to information, but actually supporting the staff to develop their own capacity and working collaboratively with the university to think about generating new evidence. Thank you very much for listening. Please do add comments either below, or you can find both myself and the TUV Library on Twitter. Thank you.